All right, well, we'll get going. Well, good morning, everyone, and thank you all so much for being here today. My name is Colleen McCarty, and I'm a program manager with the Washington chapter of the AAP. And I'm here today with Dr. Becky Schwartz, who is an AAP member and pediatrician at Renton Pediatrics. We're here to share findings from interviews we conducted with Spanish-speaking parents and Spanish and Somali-speaking family navigators on the topic of supporting families with limited English proficiency and families from other cultures with developmental screenings and early intervention referrals. So we're going to start with a quick overview on developmental screening and some context for Washington State, and then we'll share takeaways from the interviews we conducted, and then end with some strategies and resources for supporting families. And feel free to add questions in the chat as we're going. We may try to answer a few in the chat as we go, and then we'll also have time at the end for questions. So now I'll hand it over to Dr. Schwartz to start us off.
Thanks, Colleen. Hi, Becky Schwartz. And again, yeah, I'm over at Renton Pediatrics. I'm working with Colleen on this. I do apologize for my voice. I'm recovering from a cold, so hopefully it will hold through this. But yeah, so jumping in, we thought it was kind of hard to discuss this project without first just highlighting what the sort of ideals are for developmental screening. So as we know, early identification of developmental delays and timely connection to appropriate services is incredibly important for just whole child health. The most recent recommendations are from a 2020 article in Pediatrics, which I will link to on the chat in a minute. And it's adapted and updated from the 2006 policy statement on developmental screening and surveillance. One thing that we did want to point out is that the AAP has done some surveys of pediatricians and sort of self-reporting screening rates, and it's gone up from 23% in 2002 up to 45% in 2009, and then up to 63% in 2016. So screening rates are going up, which is fantastic, but we can do better. And we'll later highlight some of the challenges when working with families with limited English proficiency. As far as what we're talking about with developmental surveillance versus screening, there is a distinction there. So developmental surveillance is something that should be done at every single visit. I think of this more as like the subjective screening portion. So when this is talked about in these articles, they discuss 6 components. So, eliciting parent concerns, obtaining a developmental history, observing the child, identifying risks, strengths, and protective factors, maintaining a record, and sharing opinions and findings on what you're seeing. This is in contrast to developmental screening, which is generally thought of as more of an objective component, and that involves the use of validated screening tools. For example, the PEDS ASQ or SWIC, which many of you may be familiar with using one or more of these in your clinic. So screenings should occur at the 9, 18, and 30-month well checks with an autism-specific screening tool like the MCHAT at the 18 and 24-month well checks. And then additional screening should, of course, occur if there's a concern at any other visit as well. So we can go to the next slide. This is just one example. And again, these validated tools, most of them do have questionnaires for every single age, not just the recommended screening ages. I believe this goes up to at least 3, if not older. So the SWIC is a validated screening tool that was developed at Tufts University. Most of the time, so we'll come back to this a little bit later. This is the standard form. There are some translations available on their website as well, which we'll circle back to. This was just to sort of highlight one example, but there are some very interesting examples on here of issues that arise when working with families that may speak a different language or come from a different cultural background, to the types of questions, for example, the types of questions that are being asked. So I'll turn it back over to Colleen, and then I'll pop back in a little bit later.
Thank you. So now to switch over to some Washington specific data. According to a 2020 report from the Department of Children, Youth, and Families, about 72% of children in Washington are not being screened for developmental delays. So they reported that about 28% of Washington kids are being screened compared to the national average of 31%. And Washington has committed to implementing universal developmental screening, but as we can see, there's still a ways to go. And universal screening is especially important because somewhere around 1 in 6 children aged 3 to 17 years in the US have developmental disabilities that affect how they learn and speak and move. And the earlier that a delay can be identified and that a child can be connected to support, the better the outcomes we see for them in the long term. And then this is just a few other statistics specific to Washington state. So in Washington, we have over 800,000 kids between 0 to 8 years old. More than 1/3 of all children 8 and younger live in households with incomes at or below 200% of the federal poverty level. About 1/3 of children under 5 years old live in households where English is not the primary language. And then about 12% of children under 5 years old have some sort of special healthcare needs. And research shows us there are some striking disparities in early intervention access for children from minority racial and ethnic backgrounds, children whose parents have lower educational attainment, and children in lower income households or in households where a language other than English is spoken primarily. So these disparities negatively impact children with developmental delays who are qualified to receive timely access to services. And according to a report in the journal Clinical Pediatrics, they wrote that compared to other children, African American and Latino children are less likely to be diagnosed with an autism spectrum disorder and other behavioral health disorders, and are more likely to be diagnosed at older ages and with more severe symptoms than their white peers. And that same report goes on to say that somewhat paradoxically, perhaps, school-age Latino and Native American children and children in lower English proficiency households are overrepresented in special education settings, again, at the school age, especially those who, which could suggest, one thing they pointed to is that this overrepresentation could be mitigated by increasing earlier access to intervention services before the children reach school age. And so delays in services can have significant impacts on a child's long-term health and development. And for this reason, our project sought to understand what some of the barriers are that families in Washington are facing and learn about strategies that have been helpful in ensuring successful receipt of early intervention referrals. So the goals for this specific project were to conduct key informant interviews to understand experiences with developmental screenings and early intervention referrals, and also try to identify strategies for family support. And so we did key informant interviews with Spanish-speaking caregivers with limited English proficiency. And then we also spoke to 3 family navigators from the Harborview Pediatric Clinic. And we'll share a little bit more about that program in a minute. And our goal is to identify and summarize strategies to improve parent partnerships and parent understanding and support of parents with limited English proficiency. And so the image on this slide here is a picture of our recruitment flyer that we sent out to pediatricians and providers around the state. And then we also did outreach at developmental centers to try to connect with families whose children have been diagnosed with developmental delays or been referred to services. And so this project sought to interview parents in rural or underserved areas. So you can see here, we ended up speaking with 5 parents. They were all mothers. And so we had families from Auburn, Washington, in King County, Mabton in Yakima County, Linwood in Snohomish County, Mount Vernon, Skagit County, and then Centralia, Lewis County. And for the families that were in King and Snohomish counties, which are obviously not as rural, we selected families who are in zip codes with poverty levels that are higher than the state average. And just to give a quick summary, kind of high level from the parent interviews, 4 out of the 5 parents I spoke with recalled their providers doing screenings with them at their child's well-child visits and discussing their child's developmental health with them. 4 out of the 5 moms I spoke with said that they were given their questionnaires in Spanish. And also 4 out of 5 said that there was a Spanish-speaking staff member in the clinic for their child's pediatrician's office. That wasn't always the pediatrician themselves, but sometimes was an MA or a nurse. And for 2 of the parents I spoke with, the provider themselves also spoke Spanish. And then interestingly, maybe 4 out of the 5 moms I spoke with sought out services themselves. For most of them, they were given a diagnosis and then went and did their own research and found a developmental center to get services for their kids. And then one parent I spoke with, her children do not have developmental delays, but she was aware of a program in her community, a developmental center that accepts children with or without delays. And so she chose to send her children to that center, and it provides both the children and the parents there with education about developmental milestones and supporting developmental health. And then this slide just summarizes across all the interviews we did some challenges that families shared about kind of navigating the system. And so one of the main challenges that was talked about was navigating service agencies and just understanding kind of who to talk to, where to call. And there's lots of agencies out there. So some just kind of overwhelming or confusion around the variety of services available and how to get connected. Parents also spoke about not feeling like there's enough time in well-child visits to sometimes talk about their concerns, and feeling like they only have 10 or 15 minutes in the visit to cover a lot. And so not always feeling like there's adequate time. Several parents spoke about lack of clarity in the referral processes for intervention services. And so that came from the parents who I spoke with who ended up seeking out services themselves and didn't realize that their child's pediatrician's office was going to give them a referral to a specific place or a few specific places. They thought that they had to, when they got the diagnosis, that they had to kind of figure it all out on their own. And then a few parents spoke to the feeling of not feeling listened to in their doctor's appointments. And one mom shared with me a story that was not specifically related to her child's developmental health, but she's pretty upset about a recent experience she had with her son who had COVID, recovered, but then was still having a lot of lingering symptoms, and she could tell that something was not right. Took him back to the doctor several times and was kind of sent back and told to monitor it. And then she said eventually his breathing got very shallow, and she was really scared and worried about him and took him to the hospital. And it turned out that he ended up having pneumonia. But in sharing this with me, she was very emotional, and just the quote on the top of the right-hand slide here that is from this mom who said, "We know our kids, we know when something isn't right." And she shared that she wanted to participate in an interview because she wanted a kind of just an avenue to share that and talk about this negative experience she had. That she said prior to that, she had a really good relationship with her child's doctor, and that experience kind of made her lose some trust, and I think lose, the relationship deteriorated a bit because she felt like she wasn't being listened to when she had concerns about her son. Another big challenge that parents spoke to is the kind of stress and anxiety around wait times to get in for appointments. So this, the middle quote on the slide speaks to this challenge a little bit. Mom said that once I knew we'd be referred to Seattle Children's, I thought, we can't wait that long. I need to find my own avenue to figure this out. And so she had this just kind of stress and fear around, the thought of having to wait several months or maybe even a year to get in, and that adding to the anxiety around her child's diagnosis with a developmental delay. A couple other things that individual parents spoke to were, one mom mentioned she felt like there was a lack of direct interaction with her child in her appointments with a speech therapist. So she shared that her daughter's speech therapist, she said, my daughter's speech therapist speaks Spanish, but doesn't communicate with her directly. And she noticed a difference between her older son, who also had gone through speech therapy. She said that with her son, the therapist spoke directly to him, even though that therapist did not speak Spanish. The mom said, she made an effort to learn a few words and interact with my son. And then a few years later with her daughter, with a different speech therapist, she said she felt more like the speech therapist talked to mom directly and worked on giving mom tools for supporting her daughter, but she really wanted the therapist to do more direct interaction with her daughter. And then one last point to the challenges. One of the moms I spoke with is a single mom of 4 kids, and she just shared about the difficulties of being a single parent and trying to navigate this world of, referrals and specialist appointments, and just feeling like she needed more support, and found it a difficult system to navigate on her own as a single mom. These are just a couple other quotes I wanted to pull out because I thought they were especially salient from the interviews. So one mom shared, upon hearing that your child is going to need further support, you don't know how to be or how to react. She said, I got really frustrated in wanting to get answers right away. And another mom said that when she got the diagnosis for her child, she said, I felt like I had to consume all the world all at once by myself. And I thought these were just both very touching points that also they speak to kind of the anxiety and frustration and confusion and all the emotions that parents shared with me that go into the experience of hearing that their child has a developmental delay or may need extra support. And the parents who shared these quotes both shared that kind of in the moment, sometimes they didn't know how to react, or they just felt like it was going to be all on them to figure this out. And then in both of their cases, they ended up getting support from their pediatrician's office that they said was incredibly meaningful and helpful to them in figuring out this system. I asked parents what some helpful strategies were that they've seen in appointments that they've been in, or that they would like to see in appointments with pediatricians. And so a few things that parents shared included having good bedside manner and providing emotional support and connection with families. One mom shared with me that her son's pediatrician, after he was diagnosed with a developmental delay, the pediatrician actually helped mom get connected to a therapist so that she could get the emotional support that she needed at the time. And then kind of adding on to that, parents pointed out calling families a few days after a diagnosis can be really meaningful, just to check in and kind of let the families know that they're not alone and that they have people thinking about them. And then assisting families in placing referrals and getting kids in for services. So these all kind of speak to the points that we've mentioned that came up from several of the interviews, and just providing that emotional support and letting parents know what the next steps are going to look like, and kind of giving an overview of what that process will look like. And the quote on the right-hand side of this slide, the top one, where the mom said, understand that in the moment, parents may not know how to react or what to say or ask. And so that speaks to, again, the importance of giving that follow-up a few days later or a week later, so that families have had a chance to process everything and just have that kind of extra touch point of checking in to see if they need anything. A few other things that parents shared were emphasizing the importance of being calm and patient to families, letting them know that it can take time for referrals to go through, but that they'll help support throughout the process. And then having staff in the clinic who speak Spanish and having paperwork available in Spanish is especially important for this, what these parents shared, and having forms available in languages that other families speak just also helps with the process. And if staff members are not available who speak the language of the family, then having interpreters available at all times to ensure that communication is smooth and that nothing gets missed. And then the last couple points that families shared for helpful strategies include one mom receives in-home visits for her daughter's physical therapy, and she said that was incredibly helpful for her because she does not drive and would have a lot of difficulty getting to appointments. So being able to provide in-home services was a huge help to her. And then having that just kind of individualized attention and feeling like the provider and the therapists are, taking time to get to know the family and know their concerns and that individualized support. So next I'm going to share some findings from my interviews with the Family Navigators. So the Family Navigator project at the Harborview Pediatric Clinic is a program that has family navigators embedded in the primary care clinic. So they're not a side service, and they assist in conducting phone screenings with families prior to a child's appointment, where they can go through the SWIC screening tool that we shared a little bit earlier, and give the family an opportunity to share any concerns they have so that they can ensure that the clinic is prepared to support the family when they come in for their appointment. And so this Family Navigator project, once it was implemented in the clinic, they saw the number of patients they screened jump from 41% between 2016 and 2018 to 96% between 2019 and 2021, which is a really incredible increase. And the number of clients who followed through with referrals also increased a great deal over this time by implementing this Navigator program. And so as I mentioned, the Family Navigators conduct pre-visit phone calls with families. They shared that these calls could last anywhere from 15 minutes to an hour, depending on how much the family has to talk about. And the navigators shared that they will go through the SWIC screening over the phone with the family, and then just also ask the family about any other issues they're dealing with or questions that have come up, so that families can share what's going on with them, and then the navigators can communicate with the provider and maybe the social work team in the clinic, depending on the situation, so that when the family comes in for the appointment, the provider already kind of has an idea of what they'll be talking about and can be ready with resources. And similarly, social work can be ready if the family needs additional support. And then the Family Navigators also shared about just the value of being able to adapt the screenings as they're going through it with the families over the phone. So the navigators I spoke with two Spanish speaking and one Somali speaking family navigator. And so they shared a lot with me about just kind of the benefit that comes from having that fluency in the family's language, and having the cultural understanding and the ability to adapt questions if needed to better, so the family could better understand them or to make it more fitting for their cultural context. And so this next slide, we saw this a little bit earlier, but I wanted to bring it back to call out a few things that navigators shared with me, kind of speaking to this point of adapting the screening tools for different language or cultural needs. So I circled a few elements of the screening tools that navigators mentioned are things that could be adapted when speaking with a family. So for example, the child feeding themselves with a spoon, for a family that doesn't eat with spoons or eats with different tools. if the family had limited English proficiency and was just given the paper form with no interpretation or no one there to ask questions, they may not know how to answer the question or skip it or just say yes. So the navigators pointed out that having that ability to adapt can be helpful in just getting the correct information across, even if the specific wording isn't always applicable to the family. And so similarly with, eating specific foods like Cheerios or in some cultures, some cultures hold the belief that looking in a mirror could steal a child's spirit or, cause some negative effects. And so this point of, does the child offer a toy to their image in a mirror, would probably not be, used in that situation. And then they also pointed out the piece about walking upstairs with help as an example. If a family doesn't have stairs in their home, then the navigator said they could adapt it to say, can they step up onto a step at the playground, or, think of another way to adapt it for the family. But they pointed out just some of these examples of things that without the cultural understanding and language interpretation piece, these things could get missed. And if a child is having difficulty with the motor skills that are conveyed in these points, that could be missed if they didn't have that somebody to just help adapt it. And so to summarize some of the challenges that navigators shared with me that they've observed in working with families around developmental health and screenings, one of the main things that each navigator talked about was the language and transportation barriers for a lot of families. And so, we've talked about the language piece a bit with interpreting and translating the screening forms. And then the interpreter spoke to many families having challenges with just transportation to appointments. And also several navigators had stories about families who were called or emailed in English, and so they didn't respond to the contact attempts, and then the agency just removed the family from their list after 3 attempts. But when the navigators followed up with the families didn't even know that they had been contacted trying to schedule the kids for appointments. Some other challenges that family navigators spoke about are, some hesitancy sometimes to get the child enrolled in services. So they may have a family member who thinks that the child will catch up eventually. There can be fears of being in the system and kind of feeling like the child is being enrolled and then will be, somehow marked going forward, and some fears around that. Family navigators also spoke a lot about the challenges with the long wait lists for evaluations and intervention services, especially with the older kids age groups, so 3 and up, having different paperwork for each school district or slightly different forms. They just said can cause a lot of confusion for both for families and even for the navigators who are doing this on a regular basis. They said it can still be a confusing and challenging process. Another thing that was mentioned was the lack of summer services for children over 3 because services are provided through school districts. So they said there's been examples or instances they could think of where a child, was referred to services in May, but then it kind of got lost over the summer, or September rolled around and the school, said they didn't have the form, or they kind of had to restart the process. And so they lost all of those months where the child could have been getting support. And then they spoke about evaluations slowing during COVID as another challenge. And then finally, the lack of cultural understanding that they said can cause challenges for getting kids connected with screenings and intervention services. And so specifically, family navigators spoke about just the sometimes challenges in family dynamics if a family member doesn't want the child to be enrolled in services. Sometimes it's one parent wants it and the other parent doesn't, or it could be that parents want it, but the grandparents don't want it. So Navigators spoke about challenges with that and lack of cultural understanding on the provider's part if they kind of aren't aware of the family dynamics. And the fact that just terminology can differ in different languages and cultures. And so, some families don't have the same terminology around milestones and developmental health. And then Navigators spoke about, there's some cultures where there's a lot of stigma around developmental delays and having a kid kind of diagnosed with a delay. So these were all things that Family Navigators shared, that it can just be it can be so helpful to the family when the provider or someone in clinic has more of the cultural understanding of some of these nuances and can help just help communicate in a way that is effective and can help the family increase their understanding and ability to get connected to services. I asked Family Navigators what they thought were some of the most important skills for supporting families in developmental health, and especially families from other cultures or families with limited English proficiency. So a few of the skills they shared are relationship and trust building with the families, having sensitivity, and being aware of how you're speaking about the child or family in front of them. So one navigator shared an example, she said, where she was in the appointment with the family and the provider turned to her, the navigator, and said, like, can you explain the family's issue to me? Or said it in some language like that, where the navigator felt like, she said she felt like that kind of damaged her relationship with the family a bit because it just wasn't asked in the most sensitive way. And that the family kind of noticed that. A few other skills that navigators mentioned included having, cultural understanding about, some of the things we talked about with the screening tools, the ability to adapt questions as needed or ask them in a different way so that families can understand them better. And using a strengths-based approach is another important skill that the navigators mentioned, really highlighting, the family's strengths and what they are doing well and what the child is doing well, so that they're not just feeling like, they come to the doctor and just hear about everything that they've done wrong, or that, the parent, so that the parent doesn't feel like, this is somehow their fault that this is happening, but really highlighting their strengths and the way that, that things are working well. And similarly, the navigators shared approaching interactions as knowledge sharing rather than telling a family what to do or telling them what is best for their children. Using that approach can just lead to a lot more successful interactions and, helps with the strengths-based approach and kind of feeling like it's a team effort and that they're all on the same side. And then finally, navigators said it's really helpful when clinicians and clinic staff can have knowledge of local resources so that they're kind of prepared to answer questions from families and can have just kind of a general understanding of what services are available in their area. And then finally, some strategies navigators shared that they said can lead to more successful visits. From their perspectives, they said, speaking with families ahead of the visit and being able to notify the clinic ahead of time of the family needs is a huge benefit and just helps streamline communication and make sure that in the appointment, they're able to get to the most pressing concerns that the family has and make sure that they leave with their questions answered. Navigators also shared that establishing relationships with service agencies can be really helpful so that there's better channels of communication, and navigators or other clinic staff can follow up with service agencies after a child has been referred, and just having that relationship, they just said, makes things go a lot more smoothly. They also said having interpretation services available at all times is really a must for families who have limited English proficiency, to ensure that nothing gets missed in communication and that families are able to ask all the questions they have, and just make sure that communication can flow both ways in the appointment. A few other strategies they shared include being prepared to field questions from families, educating yourself on other cultures. So one navigator I liked, she shared that, she said, I wish, just ask yourself, what are the beliefs of this family as they're coming in? Not that every person is expected to become an expert on every other culture, but just taking that moment to think about, and kind of educate yourself on what might this family, what are some of the beliefs they may hold, and kind of how can I support them? And then one kind of more specific suggestion, but one navigator shared having the ROIs on file is an incredibly small but very helpful point, so that navigators can follow up on referrals once a family has been referred to services. So these were kind of a high-level summary of the conversations I had with family navigators and parents about these developmental screening and referral processes. And now Becky's going to share a little bit from the clinician perspective.
Thanks, Colleen. Yeah, I thought that both the families and navigators just provided some really excellent and specific feedback, and really just well thought out points. But we did want to just highlight some of the challenges that are experienced by the clinicians that care for these families. And I also feel that I need to point out that the Navigator program is just, well, super incredible. It's unique, right? Most clinics don't have navigators present, and not all clinics will have staff that speaks another language like Spanish. Hopefully there's one or two staff members that do. But even if they do, this was raised by the navigators earlier, the staff aren't supposed to translate or serve as translators unless they're certified to do so. And so, just conversing casually does increase comfort level, connection with families, but in the event that something goes wrong with the interpreter, they're technically not allowed to interpret. And so just, in general, and some other issues we experience, a lot of clinics don't have the staff or enough time to conduct these lengthy pre-visit routine phone calls. Many do provide pre-visit screening forms, but a lot of families don't, for whatever reason, they just don't get filled out or returned to the clinic prior to the visit. And as many of us know, it's extremely difficult to get standardized or formal screening done during the visit. Maybe the child screaming or trying to jump off the exam table, mom or whoever, whichever family member has brought them, they're trying to do something else, like fill out other paperwork. Maybe they have multiple siblings present, or they arrived late and the doctor comes in before the paperwork's done. If the screening's done on paper, a lot of the kids will color on the paper or rip it. If you're using iPads or some kind of device, a lot of times kids will try to play with them. They break, they drop, they malfunction. So there's lots of things that can go wrong. Just kind of trying to paint a little picture here. A lot of families will skip checkups, and this may be more likely if they have transportation issues or there's a language barrier and confusion about the checkup schedule. Sometimes they don't have any concerns, or they just forgot, or their child was sick and they canceled. And sometimes, patients just come in for sick visits, and they're not typically screened at those visits. Oftentimes other concerns or parts of the checkup will take up so much time that there's not enough time left to be dedicated to developmental screening or surveillance. And this is even more so the case when an interpreter is needed. Most clinics will add additional or sort of build in additional time for these visits that require interpreters, but sometimes the interpreter themselves can cause an issue or other difficulties. So in-person interpreters may show up late or cancel last minute. on the phone is generally more readily available in that event, but is a more difficult dynamic for conversation, maybe difficult to hear. Sometimes there's connection issues. And then, as we know, interpreter quality with either in person or over the phone, the quality varies quite a bit. And so both, we've had that experience where we can tell that there's information that's just not being conveyed between the family and provider accurately. And in addition to that, some providers and some family members may have varying levels of comfort with interpreters in general and how to use them properly. And then I did just want to point out that, whether conscious or unconsciously, it's inherently a little bit more challenging when you're observing a child whose primary language is different than your own. Of course, that's not a requirement for screening, but it may affect how you're interpreting their speech or their behavior, or you may be relying more on what the interpreter, navigator, or family member is relaying about their child. And so things can be missed that way as well. So if we go to the next slide, I did just want to point out that, language, culture differences aside, a lot of times there's just communication challenges about the issue itself. So either parent or pediatrician has identified a concern, but there's some kind of disagreement. Maybe the pediatrician has a concern, but they're so reassuring that the parents leave the visit and didn't even realize that there was a concern. Maybe the pediatrician has a concern that the parent doesn't share, or the parent has a concern that the pediatrician doesn't share. And families often don't realize they can access these services without their doctor's referral. A lot of families will understand that there's an issue, but they may want to try to fix the issue on their own, like work on it at home first, before getting referred. And then it's several months before they come in for another checkup. And then a lot of precious time has been lost if there hasn't been progress. Another common example of sometimes delays in referrals that can occur, the family or the pediatrician may sort of just assume a speech delay is simply due to being in a bilingual household or multilingual. And that's certainly a factor, but isn't always the whole story. And sometimes it can be sort of too easy to just say, okay, that we'll just watch and see, because it's probably just because they're learning multiple languages, and we'll just kind of wait it out. And then, going back to, this was pointed out earlier, but some families have just a general distrust of the healthcare system. And this may have nothing to do with developmental screening or being in sort of that system of that was also referred to, but there may have been prior issues with medical concerns, like the delay in care that one of the families Colleen interviewed experienced with pneumonia. Even with proper translation, some families may misunderstand the role of early intervention. And this is anecdotal, but I've heard of some families even mistaking early intervention for other organizations entirely, like CPS. So sort of that system means different things to different families. And then of course, as discussed before, there are these cultural and language, distinctions that are really important to make with the screening forms themselves, or discussing milestones. For example, like the stairs or the spoon example, or mirror from earlier. Another one I hear a lot is in some cultures, pointing is not really done. And so kids, we often consider that an important milestone, but a lot of times kids just never really observe that behavior. And so they may have other ways to demonstrate that. And then if we go to the next slide, I did want to just, a lot of these were highlighted earlier, so I don't want to spend too much time on this, but there are follow-up challenges that occur as well. Unfortunately, a lot of clinics don't have either a referral tracking as a system at all, or it works poorly, or there's just some issue where they're having a difficult time following up with families after they have referred. And unfortunately, we don't have a universal tracking system, which is probably the ideal, something that both providers, both childcare providers, early intervention therapists, clinician, basically that anyone could access. That would be the ideal. A lot of patients have various issues navigating the referral process, losing phone numbers, forget to call, or they receive a call but forget to call back. Maybe they don't even have a phone number. There could be issues if they don't, have regular access to a phone. Some families, as pointed out earlier, are in shock after hearing that there's a concern with their child. And I mean, for some families, that could be as bad as getting like a cancer or other, serious diagnosis, even if the provider isn't as concerned. And so some families just don't even hear what the provider said after that. They're just super worried about their child. And so they may completely miss how the referral process works. So that was something that Colleen found a few times during the interviews. And then, as mentioned earlier, some don't follow through due to the concern for getting labeled or having stigma associated with their child. Long wait times were previously mentioned, and that can be very anxiety provoking. And then also, as mentioned earlier, some families get frustrated with issues after services start. Maybe the child is not progressing like they were hoping. They can't find time off work for therapy appointments. There's insurance issues. They don't like or connect with their therapist. There could be a number of issues. Childs have a behavior issue that makes it difficult to do the therapies. So those are some of the other issues that kind of we see from our end. And so with that, we kind of came up with 10 sort of like combining sort of all these different perspectives, just about 10 takeaway points. And some of these may seem fairly, either obvious or you may be already doing a lot of these, which is great, but these were kind of the things that kept coming up in visits that or interviews that we thought would be most helpful to implement, if not already done so in your practice. And so the first one is, if you aren't already pre-screening, consider adding this. And if you already do it, trying to figure out how you can improve the return rates. As the it'd be excellent if there could be staff or navigators that followed up with families, maybe automated reminders, things like that. But whatever you're able to do to improve that process so that it doesn't have to be done during visits when there's all that kind of other chaos going on. No matter what difficulties you have getting those screens, either pre-visit or during the visit completed, it's very easy to make screening forms available in Spanish and other languages. The SWIC in particular, they have translations just available. The form is free, it's available on their website. There are certain other ones like the ASQ, I believe there's a small fee for a startup sort of fee for that one, but there are free validated screening tools available in multiple languages. Number 3 is to use interpreter consistently and correctly. So, they typically, you should be sort of speaking as much as possible directly to the patient and family. And the interpreter should be kind of not necessarily directly next to the patient, but more in like a kind of triangular position. And so they should be facilitating, but there shouldn't necessarily be direct conversation either between the interpreter and family or between you and the interpreter. It should be as smooth as possible. And then, going back to this idea of being sensitive to different cultures, language, differences, ability to adapt the screening in real time, use the interpreters to your advantage. Sometimes interpreters, if you don't have a navigator available, the interpreter can help the family fill out the screening form during the visit. And then they sometimes will raise concerns as well that the family has brought up. The next one is to use shared decision-making to address concerns, kind of meet families where they're at and try to move them towards accepting your concern. And a lot of times what helps with this is just highlighting the child's strengths. even if you have a lot of concern, okay, they seem like they have some signs of autism, or they seem just, their language is really delayed, but they're just so affectionate. They're really, just kind of make sure you highlight that. A lot of times we observe these positive behaviors, but we are trying to focus on just getting that referral going, and we just forget to bring that up. And families, that really can help them kind of feel better about what you're discussing. And the next is, just make sure you actually fully explain what early intervention is, what the role is, so that they kind of understand what they're getting into. Kind of a lot of times this is a good time to talk about the fact that, early intervention is not diagnosing their, it's not going to lead to some like labeling stigma. They're not going to end up in some special ed classroom for the rest of their lives. A lot of families have kind of misunderstandings about this. It's also a good time to just explain that there's lots of different names for early intervention, birth to 3, ESIT. There's just lots of terms. And so sometimes it's helpful to just mention those in case families get confused. I think even a lot of times providers are confused about the various terms. Child find, for the older kids, 3 to 5 versus early intervention for 0 to 3, et cetera. So, and then the next one, I always find this is really helpful just to remind families that they can refer themselves and just explain this process. It's really easy. We put a screenshot of the Within Reach hotline that's available, throughout the state, and anyone can call it. Could be patient, family, provider. They just call and request a developmental evaluation, and they have staff available who can speak Spanish. It's just a really great service. A lot of times, even if the pediatrician isn't concerned, for example, they can still say, if you still have concerns, or if this isn't happening by, the next, few weeks, go ahead and just call them, and they'll do the evaluation. Can be very reassuring to just know that it gives them kind of some control in that, shared decision making. They can kind of make that referral themselves. And then make sure we're following up with families after making a referral. How are they doing? Do they have more questions now that they had some time to process? Did they understand the referral process? And just kind of check in if able. And that could be the provider, that could be another staff member. So just something that's important that was brought up multiple times in both the parent and navigator interviews. And then if you don't already have a referral tracking system, consider developing one. I mean, a lot of EMRs have a way to track these sort of automatically, but basically just coming up with some kind of system to ensure that there's follow through once a referral has been made, or a delay or other concern has been identified. And lastly, as mentioned earlier, just don't forget to just check in maybe at future checkups. Kind of how are things going, once they're connected. Are they having any issues? For example, the child find that comes up sometimes, they may come to you and say, oh, well, we just had the evaluation done, but then they're closed, we can't do it over the summer. And then you may be able to offer an alternative therapy or referral. There may be other options. And so the other link we attached sort of isn't directly related to our project, but the Department of Health in Washington has developed a registry as part of an initiative that can be accessed by anyone through Secure Access Washington. So both clinicians, childcare providers, parents, they can use it to record developmental screens. So it's not a referral system at this time, but I just thought that was interesting to point out, that's also, something you could recommend if you don't have a way to do the pre-screens. You could have families kind of record results that way. So, and with that, I'll turn it back over to Colleen.
Thank you, Becky. Just in closing, we wanted to leave you with a few other resources and opportunities for advocacy on this topic. So there's a really great opinion piece in the South Seattle Emerald that was just published back in April by Dr. Abby Grant, who's a pediatrician who helped start the Family Navigator program at Harborview. And then Fernanda Martinez Novoa, who was a family navigator and is now a policy specialist with Child Haven in Seattle. I encourage you all to check out this opinion piece they wrote. I'll put the link in the chat, but they called out 2 House bills that are currently going through the House that would provide funding, summer funding for schools and funding for community-based providers for 0 to 3 services. So if you're interested in learning more or helping advocate, we encourage you to check those out. And then we just wanted to list a few additional resources. These are just some of the resources available that we wanted to highlight. We know there's many more out there, and we welcome anyone to share any other ones you have in the chat if you'd like. But the Washington chapter of the AAP's website has a great webinar titled Great Minds on the topic of early intervention and developmental screening. Mentioned the DOH Strong Starts program within Reach and Help Me Grow. The ARC of Washington has parent-to-parent programs and has sometimes Spanish language specific or multicultural navigators available for families in every region of the state. And there's really great resources by the AAP and the CDC on milestones and autism toolkit and guidelines on adapting the ASQ, one of the screening forms, adapting it for cultural and linguistic adaptations. So we encourage you to check those out as well if you're interested. And then in closing, I just wanted to thank the parent and family navigator participants, the Washington State Department of Health for funding this project, and Washington chapter of the AAP. And with that, we can conclude, and we have a couple minutes if anyone has any questions or comments that you'd like to share. Yes, thank you, Linda. The CDC Milestones website has an app that you can use to track milestones and is available in Spanish as well. That's a really great resource to call out. And then I see there's another comment about the Autistic Self-Advocacy Network and Neuroclastic as maybe some other resources to check out. And I will drop.
Can I say one thing? I thank you for pointing out that things like the ASQ and the SWIC both have questions that are very culturally biased, and it's hard to do, because they're kind of literally translated. So sometimes asking the question in a slightly different way or trying to get more at the essence of what the question is asking gets a more accurate result, because I get a lot of false positives, even if it's a translated form. And do you know, are there any resources for kind of getting around that rather than investing more, doctor time or physician brain? Or because we don't have navigators, I don't know if we'll be able to. Are there more culturally appropriate forms available? Do you know?
Yeah, that's a great question. Oh, go ahead, Becky.
Oh, sorry. It is a great question. I was actually trying to look into this while we were, so as far as validated, research screening tools, I don't know of any at this time. I mean, there are follow-up forms, for example, like the MChat, but of course those have the same issues. So if anyone does know of resources, I feel, I mean, the screening, as you mentioned, there's false positives, but then, they are up to our interpretation, sort of after you complete the screening, it's kind of just a tool that you use. And so I think, I know personally what I do is just at that's when let's try to adapt it and kind of see what they really meant by that. But that's sort of the best that I know of for now. And you're right that it does, take additional time to kind of sort through that.
Yeah, and I was just going to add, I put in the chat the link that was on the slide I just shared that shares some guidelines on adapting the ASQ. And they just provide a lot more, examples of things that may need to be adapted and things for cultural and linguistic considerations. And then they also have some, well, I guess they kind of cite their sources at the end. So those also provide some additional resources you could look at. And yes, to answer your question, we will be sharing this link on the AAP website, so it'll be available soon to access there. It looks like we have one other resource shouted out. Lewis County Autism Coalition has the SMART program, School Medical Autism Review Team, that's spreading to other Washington counties as well. So that's great to hear. Thank you for sharing that, Mariah. I think with that, we are going to conclude. We're at 8:02, so I want to respect everyone's time, but I just want to say thank you so much to everyone for joining this morning and for your engagement. We really appreciate you being here. And yeah, like I said, you can find this recording on our website in a few days if you'd like to access it or share it. Thank you so much.